Welcome to our fibroid education. Today we are speaking with Dr. Reynolds. Dr. Reynolds works at Novant Health Bradford Clinic OBGYN in Matthews, North Carolina. Welcome, Dr. Reynolds.
Thank you for having me. Today we'll talk about fibroids. What are fibroids? Fibroids are benign abnormal growths that grow in the muscular wall of the uterus. Fibroids can grow in many different sizes and many different locations throughout the uterus. And fibroids are very common. Nearly 70% of white women and up to 80% of Black women will have fibroids by the age of 50. Up to 50% of women with fibroids experience symptoms. And each year in the United States, more than 2 million women undergo treatment for uterine fibroids, secondary to those symptoms. We don't know exactly why a woman gets fibroids, but if her mother or sister has fibroids, then she's at risk for developing them. How do you know if your symptoms are caused by uterine fibroids? The most common symptoms of uterine fibroids are heavy or prolonged menstrual bleeding, painful periods or cramping, and pelvic pressure. I was going to go, I think there was something, sorry.
No, you're fine.
We're moving forward here ahead of going to go back to the slide that had the symptoms on it. Yeah, right there. Oh, well,
one more. We're back.
Right there. So I think we just talked about symptoms. And these symptoms can have a significant impact on a woman's quality of life. If you feel like you're experiencing these symptoms or may have fibroids, it would be important to speak with your physician or other healthcare provider, as fibroids are often suspected during a routine pelvic exam, but the diagnosis is frequently confirmed with a pelvic ultrasound or other imaging like an MRI. Many women that are experiencing symptoms from fibroids wait years before they seek evaluation or treatment. And there may be many reasons for this. They may feel that their symptoms are normal. They may think that treatments aren't available, or that the treatments that are available are invasive or require prolonged recovery. What are fibroid treatment options? If you have heavy periods due to fibroids, you should know that you have choices, as there are many different treatment options for fibroids. The first is medical or hormonal therapy. Birth control pills and other hormonal drugs can be used to manage the symptoms of fibroids. I was going to go through each one of those, but I guess we jumped.
Yeah, why don't we restart at the hormonal? I jumped the gun on that one.
Yeah, that's fine. Let's see.
I'm trying to read the pauses.
I know. Well,
the pauses are necessary though. That's like it's definitely like it sounds way better. I'm just not good at them.
Sure. Okay. The first treatment option is medical or hormonal therapy. Birth control pills and other hormonal drugs can be used to manage the symptoms of fibroids. This preserves the uterus. However, it may require you to take medication daily, and there may be other side effects associated with the medication. When therapy is discontinued, symptoms may return as well. The next treatment option is called hysteroscopic myomectomy. This is an option for only a small percentage of fibroids that are called submucosal fibroids located within the uterine cavity. With a hysteroscopic myomectomy, an instrument called a hysteroscope is passed through the cervix into the uterine cavity, and the fibroids are removed through that instrument. This is a procedure that's done without any incisions, and the uterus is preserved, but it is done in a hospital, typically as an outpatient. The next treatment option is called uterine artery embolization. This is a procedure done by a radiologist in the hospital where small particles are injected through a small incision. Well, I'll start that one over. Next treatment option is called uterine artery embolization, embolization, which is a procedure done by a radiologist in a hospital. In this procedure, small particles are injected into the blood vessels that supply the uterus, causing the fibroids to shrink over time. This does require a small incision, may require an overnight stay in the hospital, and recovery is typically 1 to 2 weeks. But studies do show that when treated with uterine artery embolization, about 30% of patients will require additional treatment over the next 5 years. Another treatment is called myomectomy. A myomectomy is a surgical removal of one or more fibroids. This can be done through a large abdominal incision or by laparoscopy, where several small incisions are used. This preserves the uterus. However, let's see. This preserves the uterus, but general anesthesia is required, and the fibroids may return over time. The recovery will depend on the type of technique used for the myomectomy and will be somewhere between 2 to 6 weeks. The next treatment option is called hysterectomy. This is the most common treatment, and it involves the surgical removal of the entire uterus and cervix. And it is the only proven permanent solution for uterine fibroids. A hysterectomy may be done laparoscopically through the small incisions, through a large abdominal incision, or it can even be completed in some cases completely through the vagina without any incisions. Abdominal hysterectomy is done in the hospital and requires general anesthesia, and a pregnancy is not possible following hysterectomy. Hysterectomy can require up to 4 to 6 weeks of recovery. What is Sonata treatment? Sonata is a treatment using ultrasound and radiofrequency ablation of fibroids. It is a procedure without any incisions. It preserves the uterus and no tissue is removed from the uterus. It is done as an outpatient, and the patient can go home the same day. How is the Sonata procedure performed? As I mentioned, the procedure is done in the operating room at the hospital. The patient is under anesthesia and is comfortable and is positioned on the exam table, very similar to a routine pelvic exam in the office. The Sonata handpiece is passed through the vagina and cervix into the uterine cavity, and the ultrasound tip on the Sonata handpiece is used to locate the fibroids while in the operating room. Once fibroids are located for treatment, the ablation zone is displayed on the ultrasound in the operating room and can be adjusted to provide optimal treatment to the fibroid. There is also a safety zone surrounding the treatment zone that is used to ensure that the energy is delivered only to the fibroid to perform the procedure safely. Is the Sonata treatment safe and effective? Well, the Sonata treatment is now available in the United States and Europe, and more than 5,000 women have been treated with Sonata worldwide. Over 40 articles have been published in medical journals, and they have all concluded that it's safe and effective for the treatment of symptomatic uterine fibroids. In the Sonata trial, more than 50% of women undergoing Sonata returned to normal activity within 24 hours. 95% of women had a reduction in menstrual bleeding at 12 months following the procedure. 94% were satisfied with their treatment at 3 years, and 88% of women reported improved symptoms at 3 years. Is this your time, or is this my time?
If you're interested in learning more about your options to treat your fibroids, including Sonata, you can visit sonatatreatment.com. You'll find our physician locator and information to speak to our nurse advocate who can help you to schedule an appointment with Dr. Reynolds. Thank you for coming.